My name is Julia Bowles, and my student number is 410591. The purpose of this video is to train new medical office assistants on how to properly sanitize, disinfect, and wrap medical instruments for sterilization. Before we start the sanitization process, we must first wash our hands and learn the necessary donning and doffing procedures. Hand washing is one of the best ways to prevent the transfer of microorganisms and break the chain of infection. The PPE we will be wearing will provide a barrier to further reduce the risk of transmission. After thoroughly washing your hands with water and an antimicrobial soap, apply your gown. Tie securely at the back of the neck and at the waist, being sure the gown covers from neck to knees to wrist. Next, we will take our surgical mask and secure the elastics around both ears. Fit the moldable band to your nose and ensure the mask fits snug to your face and under your chin. Next, apply either face shield or eye goggles. Practice hand hygiene with either soap and water or an alcohol-based hand rub. Put on a pair of disposable exam gloves and be sure to pull them over the cuffs of the gown. For sanitization procedures, it is recommended to also wear a pair of utility gloves to further protect against hazardous materials. When it is time to remove your PPE, start by grasping the used glove by the palm of your hand and remove it by pulling it away from your body and inside out. Scrunch the used glove into your other fist and using your ungloved hand, place 2 fingers under the wrist of the remaining glove. Peel downward, turning the glove inside out and dispose into biohazardous waste bin. To remove your gown, untie it and carefully pull it off and away from your body, starting at the shoulders. Take care not to touch the contaminated outside. Throw the dirty gown in the waste bin. Wash your hands thoroughly before removing eyewear and face mask, being sure to only remove by touching ears and head straps. Once again, practice hand hygiene by washing or using an alcohol-based hand sanitizer. Sanitization is the process of cleaning and scrubbing to remove residue left over from medical procedures. It's important that this step happens immediately after use to prevent blood, tissue, or bodily fluids from drying onto the instrument. Once we have washed our hands and put on our PPE, we will start the process by rinsing under cold water. Soak the instruments in a sink of warm detergent for at least 20 minutes. Next, wash and scrub instruments with a soft disposable brush, detergent, and warm water. To ensure that all debris is removed, scrub thoroughly, open any hinges, and be sure not to miss any serrations or grooves in the instrument. Rinse with hot water to remove any remaining residue or soap. Be sure to dry instruments thoroughly with the disposable paper towels, as excess moisture can cause rust and damage. After completing the sanitization process, the instrument should be left in a designated clean area until the disinfection process. Remove your gloves and dispose into biohazardous waste bin. Wash your hands thoroughly and don a new pair of disposable gloves. Disinfect your work area, sink, and any other contact surfaces to prevent the transmission of microorganisms. After cleaning and doffing PPE, be sure to wash your hands. The instruments are now ready for the disinfection process. This step reduces and eliminates most disease-producing microorganisms. Disinfectants will be classified as low level, intermediate level, or high level. The instruments we're processing today penetrate the skin, which means they're considered critical and require a high-level disinfectant. As always, start by washing your hands and applying the appropriate PPE. We will be donning a gown, mask, goggles, and exam gloves. Our solution today is an activated 2% glutaraldehyde disinfectant. It comes ready to use with no mixing required. So we will carefully pour it into a container with an airtight lid. Be cautious not to splash the chemical. Although you're wearing the appropriate PPE, the chemicals are harsh and can lead to injury. Inspect instruments and ensure they have been sanitized and dried. Place into solution carefully, setting it away from you to avoid splashing. It is important to always read the label and use the solution according to the manufacturer's instructions. This disinfectant has a processing time of 40 minutes and a reusable period of 28 days. When time is complete, wash your hands and don a new pair of gloves. Carefully remove the instrument, rinse with sterile water, and dry thoroughly with disposable paper towels. Remove your PPE and practice hand hygiene. After sanitizing and disinfecting, the next step is to prepare our instruments for sterilization. This process ensures all forms of living organisms are destroyed, including spores. The most common form of sterilization is autoclaving. Before being autoclaved, instruments must first be carefully wrapped in 2-ply blue sterilization paper to ensure sterility after the process is complete. Wash your hands and put on a pair of exam gloves. Inspect the instruments for any flaws, check they are in working order, and ensure they are 100% dry. Instruments should be placed onto 2 squares of autoclave paper. Open any hinges and cover sharp tissues with gauze. Several instruments can be wrapped together as long as they are arranged carefully with gauze to separate them. These techniques are performed to ensure that all surfaces of the instrument are exposed to the hot steam created by the autoclave. Before wrapping, be sure to add a sterilization indicator, as this will tell us that the contents of the package have reached the desired temperature. Start the wrapping process by folding the first corner toward the center, but fold a small corner back towards you. This will be done with every fold to ensure the contents can be easily opened without compromising the sterility of the instrument. Fold all 4 sides and use the same technique to wrap with the second sheet of autoclave paper. Be sure there are no openings and the contents are wrapped snug before securing with autoclave tape. Using a marker, label the tape with the date, contents, and your initials. Place the package into the autoclave, and when finished cleaning up, be sure to wash your hands with soap and water. By following these steps carefully, you will have successfully prepared your instrument for autoclaving. Thank you for watching.